now we will discuss about the structure of the secondary oocyte. Now, let us just draw a diagram to understand the structure of the secondary oocyte, right? Now, we already know that the secondary oocyte, it is just like a cell, right? It is a cell, it is a cell. Now, this secondary oocyte, the plasma membrane of the secondary oocyte, it is also called as the oolemma. It is also called as the oolemma, right? And we all know that we have a nucleus, right? We have a nucleus inside the secondary oocyte, and this is termed as the nucleus of the secondary oocyte, or we can also call it as the germinal vesicle. Germinal vesicle, right? Now, every cell will contain the cytoplasm, right? So this is also containing the cytoplasm, and the cytoplasm over here, it is given a special name that is called as the ooplasm. जैसे प्लाज्मा मेम्ब्रेन को हम लोग oolemma बोल रहे हैं, उसी तरीके से the cytoplasm will be called as the ooplasm, right? So you can use pencil colors to draw these structures, right? So this is the ooplasm. You can just mark it, ooplasm, right? So yes, now the secondary oocyte, right? It is surrounded by the vitelline membrane, right? Vitelline membrane, it is a non-cellular glycoprotein layer, right? It is surrounded by the vitelline membrane. Now this is the vitelline membrane. Now this vitelline membrane, it is a non-cellular glycoprotein layer. A non-cellular glycoprotein layer. And outside the vitelline membrane, what you can see, that is the zona pellucida is present. Zona pellucida is present. So I'm just which is adherent to this vitelline membrane, and you can see that this is the zona pellucida, the one which I'm like highlighting in green color. Yes, this is the zona pellucida, right? Yes, so this one, it is the zona pellucida, which is like adhering to this vitelline membrane. So remember, zona pellucida. It is a glycoprotein structure. You already know it is a glycoprotein layer. Now, you already know the secondary oocyte, it is getting surrounded by the granulosa cells. Now, the granulosa cells which are now surrounding the secondary oocyte, they are given a special name known as cumulus oophoricus. Now, these granulosa cells or the cumulus oophoricus, they are arranged around the secondary oocyte in a sun ray pattern, and this is something which is called as the corona radiata. It is called as the corona radiata, right? It is called as the corona radiata. So you have to remember that the secondary oocyte, it is formed after ovulation. The cumulus oophoricus cells, so you can mention over here also the cumulus oophoricus cells, right? They will surround the secondary oocyte in a sun ray pattern. It will surround secondary oocyte in a sun ray pattern, and this is something which is called as the corona radiata. Corona radiata. सो ये क्यूमुलस oophoricus क्या है? These are nothing but the granulosa cells, and इसको special name इसलिए देते हैं because they are just present around the sides of the secondary oocyte, which is called as the cumulus oophoricus. And these cumulus oophoricus, they are arranged in a sun ray pattern, which is again termed as the corona radiata, right? Now you already know the vitelline membrane, it is surrounding the ooplasm and the oolemma, right? Now there is a space between the oolemma and the vitelline membrane, and if you can clearly see the space which I am marking with blue, right? This space, this is called as the entire space that is present between, this is called as the perivitelline space. Yeah, this space. This is called as the perivitelline space. I have not highlighted everything, but you can highlight perivitelline space. This is the space present between oolemma and vitelline membrane. Oolemma and vitelline membrane. And remember that, the first polar body, okay, the first polar body, it is seen in the perivitelline space. So I can draw this over here. We have the first polar body, and remember that the first polar body, it is present in the perivitelline space, right? So this is regarding the structure of the secondary oocyte. Now coming on to the next topic, that is the events which is leading to fertilization. So you already know that there is ejaculation, okay, there is ejaculation into the female genital tract, right? Now from vagina, you already know they are like around 2 million sperms which will enter the cervix. Around 2 million sperms, they enter the cervix. The 2 million sperms, they enter the cervix. Now sperms, what they will undergo? Capacitation. Capacitation will occur, right? You already know capacitation means the ability of the sperms to fertilize the ova. Although sperms are mature enough in the epididymis, but they are not mature enough to fertilize the ova. So they become they have the ability to fertilize once they attain, like capacitation occurs in the cervix. Now after capacitation, you already know the sperms will become hypermotile. The sperms become hypermotile. Now after that, from the cervix they will reach the fallopian tube, right? You already know the structure, right? So yes, this is, let us suppose this is the uterus, this is the fallopian tube, right? And we already know we have this cervix. From the cervix they will travel and they will try to reach the fallopian tube. They will reach the fallopian tube. The sperms reach the fallopian tube. The sperms reach the fallopian tube. They are around 300 to 500. Around 300 to 500. Now, the sperms will attach to corona radiata. The sperms will attach to corona radiata, right? And you already know the sperms, they are having acrosomal cap, and from the acrosomal cap of the sperm an enzyme will be released that is called as hyaluronidase, right, which will dissolve the corona radiata. Now sperms will attach to corona radiata, and acrosomal cap of sperm. Basically, they contain hyaluronidase, and this hyaluronidase is released, which will dissolve the corona radiata, which will dissolve corona radiata, right? Now, after this, what will happen? The head of the sperm, repeating last line, the head of the sperm, it will attach to the membrane or the oocyte membrane. Head of the sperm attaches to oocyte membrane, that is called as the oolemma, right? Oocyte membrane को क्या बोलते हैं? oolemma. So it will attach to the oocyte membrane, right? Now what will happen after the hyaluronidase has like dissolved the corona radiata? Remember that out of 300 to 500 sperms, right? Out of 300 to 500 sperms, only one sperm, okay, only one sperm attaches to ZP3 receptor, okay, that is called as the zona pellucida receptor. We have three types, 1, 2 and 3, right? So remember it will attach to the ZP3 receptor of zona pellucida, and remember you already know the zona pellucida has ZP1, yes, we have ZP2 and ZP3 receptors, right? ZP3 receptors. Out of these three receptors, ZP3 receptor, it is like the one on which the sperm will attach, and only one sperm will attach. Now, this sperm will get entry. You already know zona pellucida के अंदर क्या present था? Structure of the secondary oocyte याद करो. Perivitelline space. The sperm will get entry into perivitelline space, right? The sperm will get entry into the perivitelline space. What will happen now? The meiosis 2 will be completed. The meiosis 2 will be completed, right? I have already told you the meiosis 2 only completes at the time of fertilization, right? Now after that, what will happen? The head of sperm will attach to the oocyte membrane, right? That is called as the oolemma. And yes, it will release some cortical granules, right? It will release cortical granules, and these cortical granules, remember that these cortical granules basically they make the zona pellucida impermeable to other sperms, right? So remember, these cortical granules make zona pellucida hard, and yes, it inhibits entry of other sperms, right? And it inhibits entry of other sperms. So this is what is actually happening. So once if you know the structure of the secondary oocyte, this is like very much clear. You already know the secondary oocyte, it is covered with oolemma. After that we have the vitelline membrane, then we have zona pellucida. So zona pellucida के बाद कहाँ आएगा? It will the vitelline membrane, the perivitelline space, and again it will attach to the secondary oocyte, right? And yes, so that is all about the events which are leading to the fertilization. Now coming on to the next one, that is the female infertility. The female infertility, Now, female infertility. Now, when I say female infertility, it is basically the inability, okay? It is the inability of the female. It is the inability of the female to conceive after 1 year of protected intercourse, unprotected intercourse. Unprotected intercourse. So, after 1 year of unprotected intercourse, if the female is not able to conceive, that is something which is called as the infertility. Now, yes, if like in a normal female, like if it is less than 35 years of age, so it is like the criteria, like it should be after 1 year of unprotected intercourse, right? After 1 year of unprotected intercourse. So we say that the female, the infertility has begun, right? Or if a female is more than equal to 35 years, so there is a criteria after 6 months. After 6 months, or if she is more than equal to 40 years, then like it is after 3 months of unprotected intercourse, which will tell us that she is infertile, right? Now, there could be various causes for infertility. Now, there could be various causes for infertility. Now, whenever a couple visits, the infertility clinic, so yeah. Now, what we do, the first investigation, it is semen analysis. It is to be done in all the couples who complain of infertility. Now, all the couples who complain of infertility, right? What we have to do, the investigation should be first the semen analysis of the male partner, right? The semen analysis. You have to do serum progesterone level, right? You have to do serum progesterone, and especially like serum progesterone levels on day 21 of the cycle, right? So the day 21, it is like the test for an ovulation. Test for an ovulation. Ovulation हुआ ही नहीं. There is no secondary oocyte which is formed, right? So yes. Apart from that, you should remember what is like the causes for female infertility. Now, if I simply say, let's just write it out. What are the causes for female infertility? Now, there could be ovarian causes, right? There could be ovarian causes if suppose she is suffering from PCOD, that is polycystic ovarian syndrome. Polycystic ovarian syndrome, right? Apart from that, if she is having like Kallmann syndrome, or there is ovarian insufficiency, I can simply say like the primary ovarian insufficiency. It can also lead to this, right? Or if there is increased prolactin, this is also a cause of female infertility. Increased levels of prolactin, right? Apart from that, there could be tubal causes also. Now, when I say tubal cause, it's simply I'm indicating the fallopian tube, right? Fallopian tube. You already know the fertilization takes place in the fallopian tube. And which part of the fallopian tube? It is the ampulla, right? It is the ampulla. So, if there is endometriosis. Now, when I say endometriosis, it means that the endometrial tissue. Now, let us see this. You already know, let us suppose this is the fallopian tube and this is the uterus. You already know the uterus has 3 lines, right? The 3 layers. The innermost, it is the endometrium, and endometrium will contain the endometrial tissue. If this endometrial tissue from the uterus, if it comes in the fallopian tube में तो endometrial tissue का कोई काम नहीं है, but if the endometrial tissue it is found in the fallopian tube, ectopic place पे ना unusually present है, so this is called as endometriosis. And you already know the fertilization, it takes place in the fallopian tube, the ampulla part, right? So that is again one of the tubal causes. Apart from that, there could be like infection of the fallopian tube, that is salpingitis. Okay, salpingitis, itis लगा देते हैं ना. Yes, salpingitis, that is one of the cause for infertility. Apart from that, if there is like defects in the uterus, so we have the uterine causes also. Yes, there could be submucosal fibroids if they are present, endometrial polyp if it is present, right? Or there are Mullerian malformations. In the upcoming lectures, I will be discussing about the Mullerian malformations, right? If there are Mullerian malformations, right? We have Asherman syndrome also, and other like DES exposure and other things, right? If we talk about the cervical causes, or they are unexplained causes, so if there is an infection of the cervix, that is cervical causes, you should remember, if there is an infection of the cervix, that is called as the cervicitis. So that can also lead to this female infertility. So that is about the female infertility. Thank you.